Hi, it's Dr. Lewis Clark. I want to thank you for joining me on this How to Heal Leaky Gut Naturally series of videos here. So last time, if you remember, we talked about what is leaky gut. And we're going to go a little deeper into that today to help understand the cascade of events that begin to happen when you develop this syndrome that we're calling leaky gut. It's also called intestinal hyperpermeability. So we'll look at that here. What is leaky gut? It's intestinal hyperpermeability, meaning that your gut is supposed to be permeable, meaning that when you break down food into its essential components, it's supposed to cross through the gut lining into the bloodstream so that it can go to the cells of the body and do its work. Hyperpermeability means that gut lining is opened up and now it's allowing things to pass through that are too big to normally to pass through, and now it's starting to get things into the bloodstream that are not commonly found there or not to be found there safely. And what I mean, as you're going to see, is that this intestinal junction malfunction means that those cells joined up together tightly, that tight junction has been lost. That's basically what leaky gut is. And now we're going to go into what happens when things start to get into the bloodstream that are not supposed to be there. And we're also going to go into this vicious cycle of what cranks it up. So here's what happens. So you get intestinal inflammation of the gut lining, which opens up the cells. Then you start to have malabsorption, especially of things like vitamin B12 and iron. Most people don't realize that their anemia associated, their iron deficiency anemia is associated a lot of times with malabsorption. So iron is one of the most difficult minerals to absorb. And therefore, if you have gut inflammation and this hyperpermeability that I'm talking about, you're going to have malabsorption. And magnesium, iron, B12 are common. But you can also have some fat-soluble vitamins that are deficient as well. Then you get an immune response. Why do you get an immune response? Is because now things are into the bloodstream that are not supposed to be there, and God has given you a wonderful system to protect you from things like that called your immune system. So your immune system responds to this, then you end up getting what's called food sensitivities. And that is because if a food particle, a protein in particular, that's not broken down completely, is found in the bloodstream, say something like gliadin, which comes from wheat, also commonly called gluten, and then also, or maybe casein, which comes from dairy. If they're found in the bloodstream, these proteins, your immune system is going to attack that. And if it sees it again the next day, it's going to attack it again. And so then it's going to tag it. It's going to put an antibody on that because it says, hey, you're an invader. You're not supposed to be here. The next time that you show up here, we're going to bring an army of immune response here to wipe you out. And that's what a food sensitivity is. Now your body has actually identified food as an invader and it begins to attack that. And that's a bad thing because if that's going on, you're hyping up your immune system and you don't even know it. You don't even know that the foods that you used to be able to tolerate are now part of your problem, leading to all of these immune system problems, gut problems, and neurologic problems. And then lastly, this is the final progression, is that you end up with an autoimmune disease because you do have an upregulation of your immune system. Now you can begin to get your own tissues beginning to be attacked, especially like gut. So things like ulcerative colitis and Crohn's, and of course celiac disease, but also things like Hashimoto's, which is thyroid autoimmunity, peripheral neuropathies, pernicious anemias. The list goes on and on. Psoriasis, eczema. There's all kinds of autoimmune conditions that can be led to because of this vicious leaky gut cycle. So I need to spend a little bit more time on this. We kind of went into this a little bit last time about how did I end up with this? What are the mechanisms that got this started in my body? I don't think we think enough about, especially this one here, medications. If you've been on non-steroidal anti-inflammatories for a long period of time because of pain, joint pain, that is going to affect your gut. If you've been on antibiotics even once, one dose of antibiotics, according to research, can take up to 6 months to 2 years to recover. Meaning that you get your gut bacteria back and you get your intestinal lining back to normal, can take between 6 months and 2 years. What do you think the chances are that that person might have another round of antibiotics before they even recover from the last one? And unfortunately today in our healthcare system, our medical model is that antibiotics are passed out very easily and commonly with the assumption to the patient that there's no detriment or long-term consequences to it. I'm going to tell you right now that is not true. Other things like corticosteroids are huge. We've already went into diet, but I want to touch on one more thing here, and that is if you are in a chronic stress load, you are going to ultimately begin to suffer with digestive problems from loss of intestinal integrity in your small intestine in particular. So keep in mind that stress plays a huge role in this. And one last thing I need to say too is blood sugar. Blood sugar is a big problem in America, and that is a big problem for this. So what happens? The immune system begins to attack self-tissue. That's an autoimmunity, right? And there's different levels of autoimmunity, and I want to kind of break these down for you because the first stage, you don't even know you got it. It's silent. But already you've tagged some of your tissue as being foreign, and you're beginning to develop an immune response against your own body, and it's beginning to damage tissue. But you don't know it yet. Then once it gets bad enough, you start having reactivity, which means that now you've got symptoms, but you still don't have a disease. And once it ultimately progresses to stage 3, now you have enough damage in your thyroid, let's say, to the point where now you have hypothyroidism. Okay, so there's a progression, and unfortunately a lot of times it's going on silently for a long time. You never know until all of a sudden you've got rheumatoid and you're getting joint damage, or you've got Hashimoto's, you're getting thyroid damage, or you've got peripheral neuropathy, or even autoimmune diabetic problems, and you don't know why they're coming. So that's the autoimmune process. So I'm going to leave you with this slide today, is that there is this intestinal permeability, which affects your food sensitivities, especially like gluten and gluten cross-reactivity, which is things like dairy, and then ultimately leads to autoimmunity. So I don't know where you're at on this, but the sooner you catch it and start dealing with your health, especially if you have some of those mechanisms that we've already talked about, the better you are. So if I can help you in any way, let me know. And until next time, when we start going into some of the solutions, I ask you, live life well, and may God bless you.